Thanks for inviting us in tonight. A COVID vaccine for kids under the age of 5 could be just a couple of weeks away. Pfizer applied for emergency use authorization just a week ago, and this could get the green light by the end of this month. So tonight we want to dig into how this version differs from Pfizer's other vaccines. We're also going to take an inside look at how this approval process works. But first tonight, our Emily Longnecker kicks things off with perspective from local parents and doctors.
If this latest vaccine for children ages 6 months to 4 years is approved, places like Riley Hospital for Children could see arrival of doses within weeks. That is good news, say doctors here, who say they've seen their fair share of COVID patients who are children hospitalized, most of them unvaccinated, with at least 4 of them under the age of 6, they say, losing their lives to the virus.
Yay. He's only 14 months old. Little Aras Rivsvi, too young to even understand yet. He was born during a global pandemic and how that shaped his first year of life.
For the most part, I really don't take him out still.
Her mom, Soha, isn't just protective of her baby because he's her first. Soha is a family medicine doctor and knows all too well the dangers of COVID-19. That's why she kept breastfeeding Aras as she got the vaccine and booster, knowing she could possibly be passing on some antibodies and protecting her baby from COVID.
And there are a lot of studies coming out now that shows that the antibodies will pass through the breast milk.
Now this new mom is even more excited to learn Pfizer has applied for emergency use authorization for its vaccine for kids younger than 5.
The concentration of the strength of the vaccine is going to be about a tenth about what we get as an adult.
Dr. John Christensen, Riley Hospital's Associate Medical Director of Infection Prevention, says he's talked to parents whose children were hospitalized with COVID and unvaccinated.
They recognize that the vaccine could have been beneficial to them.
That's why he hopes parents with kids under 5 will get the vaccine for their children when it's available.
The reality is that these vaccines, we've been giving them for over a year, and so we have a pretty good idea about the safety of these vaccines.
Soha Rizvi isn't worried about the vaccine being unsafe for her son, not as a doctor, and just as importantly, not as a mother either.
As a mother, I obviously want the best for my child, just like any mother does. And I do believe that this is the best protection. I would, give it to him in a heartbeat.
Now let's take a closer look at that vaccine approval process. Whether it's for kids, babies, or your booster, the manufacturer has to go through multiple steps to get the green light. First up, the trials. This takes several phases to gather data and then show regulators. Then the FDA's Vaccines Advisory Committee reviews info for the FDA to approve. Also, an independent committee reviews the safety and efficacy of a vaccine for the CDC so they can then issue guidance on how to administer the vaccine. And it's not clear for the public until the FDA and CDC both sign off.
As we wrap up tonight's big story, I want to dig into Indiana's COVID numbers a bit more. Right now, we are seeing a decline in COVID cases reported across Indiana. In fact, they've dropped 75% in the last 2.5 weeks. But this still represents 3,000 Hoosiers testing positive for COVID. Let's talk about people in the hospital with COVID. That number also is down from the peak that we saw back in mid-January. Still a lot of ICUs still struggling across our state. Last month, Methodist Hospital asked a team of FEMA members to extend their stay and offer support. The 20-person team consists of doctors, nurses, and respiratory therapists. They tell us that healthcare workers are still feeling the weight of the recent wave of hospitalizations.
Even though the surge is going down, we're still having the same patient loads. So it's still, when one patient moves out of a room, another patient is coming in a room right away. So it's still full to capacity.
FEMA assistance will continue a couple more weeks, but the team tells us they're ready to extend their stay again if they're needed.